MRI has been available for us as urologists now for about 10 years. The first study that really showed it had potential was published in 2006, and since then there have been a number of studies showing us that an MRI-based approach to diagnosis is considerably better than the standard of care at diagnosing men with clinically significant prostate cancer. I presented the results of 7 randomized trials. That's a lot of high quality level 1 information. Most of the recent trials from those 7, and indeed the largest ones, are positive for an MRI-based approach, and indeed they show a doubling of the diagnosis of men with clinically significant cancer compared to the standard of care. There is another trial which is going to be presented at the European Association of Urology next month in March 2018, and that will, I think, probably culminate the trial evidence that we need to inform this. The results as yet are not available. Earlier this year we published the PROMIS study. This is a large-scale study that was designed specifically to see if we could rule out prostate cancer with MRI and therefore avoid a lot of unnecessary biopsies in men. It wasn't a randomized study, and what it did, it compared standard of care, which is trust biopsy, versus an MRI-based approach to diagnosis against a reference standard which was 5mm template sampling in all men. This study will never be repeated. It was a huge undertaking. It cost a lot of money. It took a lot of time to do. Patients gave a lot of themselves to take part in the study, but it did show us that the standard of care, trust biopsy, is not very good at all, in that it misses half of all clinically significant prostate cancer. And I argued today that if we are going to offer men standard of care, trust biopsy, and I think about a quarter of the audience said they would do that, then we need to tell patients that the test we're doing will miss half of all clinically significant disease in you as an individual. And we now know that there's a better test, so the onus is now on us as a profession to get the quality up and make MRI available to all patients who might need it or indeed want it.